Hello, welcome to the program, and today we're going to talk about a subject that troubles many people, many times people in their teenage years and sometimes after that. And talking with us today about the subject is Dr. Phil Mills. He's a dermatologist. Welcome, Dr. Mills.
Yes, and you mentioned it's frequently with teens, and of course it is. 85 to 90%
And we're talking about acne.
Have acne. But many, particularly women, come to me and they're embarrassed. They say, I should have had this done after my teenage years. But in fact, 10% of women will have acne into their 40s and 50s and even 60s. Some will develop it new in their 40s and 50s. So don't be embarrassed if you have acne, late onset acne.
Okay, so what causes it? What can we do about it?
Acne is by and large caused by hormonal balances in the skin. The skin is a very complicated organ of the body. And around certain areas of the skin, they have oils that are produced and then they coat the skin. These oils, for some reason, can't get out of the little pipes that pipe it to the skin. The pipes become sticky. And so these oils are still being produced, and instead of coming out on the skin, they back up inside the oil-making, these gland-making mechanisms. And then the germs there, they say, my, Christmas has come. And so they have all of this really luscious food to eat. It's warm and no ugly oxygen killing them, and so they just have explosion of growth.
So how can we put a damper on the bugs and their feasting? Let me ask you this question also. You know, I seem to notice when I develop an acne type spot or something that sometimes it's related to something I've eaten. Is that true? Does the curse come causeless, or what's the issue here?
Well, for years, we as dermatologists said absolutely there is no relationship between diet. But most recently, there has been, in a very good study, they have found that diet can be related, particularly in severe acne and milk. We think that it's related to the hormones that are being fed to the cattle and the hormones in the milk. That may be one of the issues, although there are probably others.
So you can avoid dairy products that may help you. What do you do to treat this?
Don't scrub. Sometimes people really try to think, oh, it's my skin is dirty, and so they irritate their skin more by doing sandpaper and all kinds of very abrasive kinds of things. Actually, the problem isn't, at least in most cases, because there's dirt on the face. It's you want to use a very mild soap, such as Dove without fragrance or other very mild soaps, and then pat yourself dry. Don't inflame the skin more. Then there are certain types of topical treatments. Benzoyl peroxide, which acts as an antibiotic and also a drying agent to the skin. There is a type of vitamin A, which is in Retin A and other commercial products that may need to be prescribed by your physician dermatologist, and these help dry them up. Some cases, for short periods of time, antibiotics need to be given. Generally, a combination of these kinds of treatments in more severe acne. If the acne is only, say, during a week or two, every so often, we don't have to treat as diligently.
Well, so the best thing to do is to avoid those things in your diet that maybe can cause a problem. Make sure and not abrade the skin when you're rubbing it and scrubbing it, or really don't do that. Those Dove soap and then trying to dry it out. Then if you're still having problems, see a dermatologist.
That's correct.
Thank you, Dr. Mills, for spending time with us, and thank you. We hope this is helpful. If you need more information, go to our website at NEWSTART.com, and you can get some more information on this and other subjects. Thanks for being with us, Dr. Mills.